Leonel, my doctor is monitoring my calcium levels, which are elevated, but said I'm okay as long as they do not reach 11. What can I do to lower my calcium levels that are around or just over 5 at this time? But if your calcium levels at 5, that's too low. The normal calcium level, you want it to be less than 10, about between 7 to 10, 8 to 10 is ideal. It's a close range for calcium. If there are problems with calcium metabolism, that can be due to your thyroid gland or your parathyroid gland. I'm presuming since your doctor is monitoring it, that he's monitoring those things. You need to monitor your parathyroid hormone levels, more specifically associated with calcium, but so can your thyroid hormones as well. The problem with calcium abnormalities is this: calcium can go up or down in relation to lytic lesions in your bones. There's a disease state called multiple myeloma that does damage to the bones, and then some cancers, once they have gone to the bones, the cancer has metastasized to the bone, and the bone starts to break down, you get high calcium levels as well. So your doctor seems to be on top of this. I don't think that is the case, but again, that is one of the things that's on the differential diagnosis list to make sure it's that. But when your calcium goes either too low or too high, it is associated with cardiac arrhythmias. In other words, instead of your heart beating like this, the way that it should, loved up, and pump steady, it fills up with blood, it pumps the blood out. It fills up with blood, it pumps the blood out. That's how the blood circulates, moves around your body, goes all the way to your feet, and then comes back to your heart. Steady. When you have high calcium, it can do this, it can flutter, or it can seize. It can stop pumping. Same thing when the calcium is low. Most of the time when it's low, you get the cardiac arrhythmias. But when it's high, you get the great arrhythmias, or you can get seizure of the heart. It just stops pumping. So it's very important that you try to keep that level below 11. That's a magic number. And so again, it sounds like he's sophisticated enough to understand what he's doing, and so it's a matter of communicating that with you. But I would not take any calcium supplements. Sometimes you don't know things that you're taking in have calcium in them. So this is a time to read labels. But again, a lot of foods are high in calcium. In this situation, you need to avoid them. Of course, the number one things would be milk products, yogurts, etc., that have calcium in them. But a lot of things are supplemented with calcium because people need calcium to maintain good bone health and good tooth health. So to maintain healthy teeth and strong bones, you need calcium, but you don't need too much of it. You don't want it floating around. As long as it's in your bones, it's fine. As if it's floating around in your blood, again, that heart, which should be beating like this, now can do this, which is not efficient and effectively pumping blood. It's just moving it back and forth. And when blood doesn't move, it clots. When blood clots, that's when you have a heart attack or a stroke, or the heart just seizes and locks up and it stops pumping totally. And you can get all the CPR that you want, but that heart is under the influence of that calcium, and it's not going to start back pumping. There are things they can do. They can chelate that calcium out of your body if they can get to you quickly enough in doing so. But the vast majority of the time, they find out all this after autopsy because nobody can get to you in time and figure out that that's the problem. They'll just treat you as if it was a heart attack, which technically it is. But again, the heart seizure due to calcium excess is different from that of a cardiovascular challenge that causes a heart attack. Okay, great question, Lynn.